As the introductory remarks indicated, this is the first year that we have added a capacity building and training session for government officials. And I'm really, I can't tell you, I'm very pleased that the response to this session was much larger than we anticipated. And I think that is really encouraging that so many government officials from across the region are, interested in finding out more about how they can potentially implement this rigorous form of evaluation, and that we very much feel that this is so important for to inform your policy development in the future. So let's go ahead with the session today. It will be conducted by ID Insight, and ID Insight is a client-oriented organization. It partners with government departments, NGOs, foundations, and multilaterals to create and execute robust measurement strategies at informing critical strategic decisions. They apply rigorous research and evaluation tools, such as impact evaluations, to help policymakers improve their social impact. Our first presenter is Aya Silva. She is a senior manager at ID Insight, based in Manila, Philippines. She manages M&E and advisory projects across the Southeast Asia region in several sectors, including gender, workforce development, and financial inclusion. And with that, I will turn it over to you, Aya, and wish you the best with this session. Thank you.
Thank you so much, Linda. Actually, Karan will get us started and then I'll jump in.
Thank you so much, Linda, and thanks to the ADB for inviting us to give this presentation. So yes, this is going to be a session on impact evaluations. It's going to be, a sort of initial starting course. So it will be fairly brief and basic. And, we will talk for about 50 minutes and then hope to have time at the end for Q&A. And so, I will start by describing a little bit about our organization and, how we use impact evaluations in our work. I will then walk us through, some of the concepts and, definitions of impact evaluations. And then throughout this presentation, we will, use three motivating examples from our own work with NGOs and governments around using impact evaluations in a way that they contribute to decision making, in a way that they are integrated within the practical policy cycle. And actually useful. And then, we'll conclude with the Q&A. Before I start, I wanted to, briefly introduce our organization, ID Insight. We work across Sub-Saharan Africa, Southeast Asia, and South Asia with many governments, NGOs, and foundations. And we use data and evidence to help them take better decisions. What distinguishes us is that while we leverage a rigorous analytical toolkit, we customize that and fit that within the constraints of the partner's needs. And so in particular, in the case of governments, we customize that and fit that within the administrative and political constraints that all of you as policymakers face. And one of the examples that we will be using to explain many of the concepts here is our impact evaluation with Educate Girls. Educate Girls is a large NGO based in India, and they focus on educating girls, and they were trying to solve this problem of low enrollment and low learning levels among school-going girls in northern India. And we evaluated Educate Girls' work as part of a development impact bond. As an aside, it's basically an innovative financing instrument where a funder says to the NGO, look, if you achieve a certain amount of outcomes over a predetermined time period, then you'll get a large payout. If you don't, then you will not. So it's a form of results-based financing, except in this case, the result is sort of determined through a rigorous evaluation done by an independent third party, which is what we were doing. And so so we validated them as part of this development impact bond. They were trying to solve this problem of low enrollment and low learning levels, and the way they try to solve this is by recruiting local volunteers, community volunteers, that then go door to door to encourage enrollment of girls in schools, as well as providing supplementary education, to supplement what they're learning in school, which is not enough. And so that's the that's the example we'll use throughout this the next few slides to illustrate some of the definitions. And so an impact evaluation basically is an evidence tool. It's an exercise to measure the effect of the intervention. So in this case, the intervention would be Educate Girls program to recruit and train local volunteers on the outcomes it intends to change, which is learning levels of girls. And learning levels of school going children change for a number of reasons. You know the They could be teacher training programs, there could be government intervention, new schools could be built, etc. But only some of those changes are attributable to the program itself, which is Educate Girls program. And so what an impact evaluation does is it measures changes and outcomes that are directly attributable to the program itself and not everything else. And how it does it is by constructing a counterfactual, constructing a state of the world that doesn't really exist, constructing this sort of uh, uh, state in which the program would not have happened. So impact evaluation is a comparative concept. It compares what is actually happening with what would have happened if the program had not been implemented, which is the counterfactual. And that's quite hard to construct, because that either the program happens or it doesn't happen, right? So it's very hard to construct this sort of counterfactual, and the art of constructing the counterfactual is the impact evaluation. And so, for example, in this case, imagine this graph. Imagine you are showing girls test scores or learning level scores over time. And the graph is broadly rising over time. And the program sort of starts midway through the academic year. Now, as you can see, the graph keeps rising once the program begins. And so can we say that the program was successful from based on this graph? The answer is, probably not, because, test scores rise during the course of the school year for a number of reasons. And so, children grow older, teachers, teach them more material over the course of the year. So this may have happened anyway. Or, maybe the program is actually working, we don't know. And so really just looking at this graph, the yellow line, the scores that we actually observe of the girls that are being trained in the program, that doesn't tell us anything about the impact of the program. For that, as I said, you need another state of the world in which you sort of measure what would have happened if the program had not been implemented. And that's the blue line, the counterfactual. Now, the difference between what would have happened if the program had not been implemented, the blue line, and the yellow line, which is what we observe once the program is actually implemented, that's the impact of the program. Because, and the reason why that's the impact of the program is because without the program also, the blue line would have happened anyway. It's the additional work that has come thanks to the program. And it's important to know the counterfactual, because in this case, as you saw, the impact was positive, but it's possible that that we would have observed a trajectory like this. There are many reasons why we could have observed this trajectory. Maybe the program is actually ineffective and teachers are being taken away from their core work, and so they become and therefore they're not able to teach. And so actually without the program, actually the scores would have been much higher. That's also possible, in which case the program would have been negative. And the other problem with looking just at what happens is that maybe what we see a negative trajectory, but this doesn't capture the fact that a lot of else is going on at the same time. So for example, maybe at the time the program starts is when the COVID-19 pandemic hits, and children are now at home and therefore they can't go to school. And you know and we observe a negative trend, not because of the program but because of something else that happened. And the only way we know whether the program is working or not is if we observe what would have happened if the program had not taken place, the counterfactual. And so in this case, you see that counterfactual would have made things even worse. And so therefore the program effect is still positive. And so those are the reasons why we need to construct an alternative state of the world in which the program does not take place, to actually be able to measure the impact of the program itself. I know, as I said earlier, it's quite hard to actually construct and measure this counterfactual, which is what would have happened to program participants in the absence of the program. Um, but we never observe the counterfactual. We don't observe it because either the program takes place or it doesn't take place. By definition, the program participants get the program, so there is no state of the world in which they don't get the program. And the solution is to find a comparison group. In technical jargon, it's called the control group. A comparison group that looks just like the treatment group. The treatment group are those who get the program, the beneficiaries. So you're constructing two groups, or maybe more than two groups. These groups look the same on all characteristics, on all aspects, before the program begins. And then one of the groups gets the program, the beneficiaries. That's called, in technical jargon, the treatment group. And another that does not get the program, that's called, in technical jargon, the comparison group or the control group. And so you construct these groups, they look the same in all respects before the program begins. Then one gets the program and the other does not. And therefore, really what's different between these two groups is that one of them got the program and the other did not. And so when you measure their outcomes again after the program has been in force for some time, and if they are different, then you can say that that difference is because of the program. It can be attributed to the program itself. And so there is a number of ways of constructing these counterfactuals. Many of you would have heard of randomized control trials or randomization. I will not go into detail in all of these techniques. I just want to emphasize here that randomization is not the only way to do an impact evaluation. It is the most rigorous way, where you are randomizing villages or individuals into different groups. But there are non-R randomized control trial ways also of measuring the impact of an intervention. And impact evaluations can help with many types of decisions. Some of these we illustrate on this slide, and we will illustrate using our examples. So one is to just determine whether the outcomes that you seek to change, have they actually changed or not. Second is to be able to say, okay, should we change the program? Should we make some mid-course corrections in order to be able to improve the program? The that So we'll illustrate this using the examples from Educate Girls. My colleague Aya will talk through our evaluation in the Philippines, where we try to promote hand washing practices in schools. And there, the decision you were trying to inform is whether to scale up the program or not. So it was at a sort of mid stage, and so to scale up the program or not. And then finally, you can implement the program in multiple ways, and impact evaluations can help you determine which of those ways is most effective and most cost effective. And so we will illustrate that using the example of insecticide treated bed nets in Zambia. And so, I'll head back to the Educate Girls example. Just to remind you, this was an evaluation of Educate Girls, which is a large Indian NGO. They were trying to solve the problem of low school enrollment and low learning levels in schools in Rajasthan, which is a state in northwestern India. And their intervention was to train and deploy community volunteers to encourage, go door to door and encourage parents to enroll their girls in school and provide supplementary education. And so the objective of this evaluation was to measure the impact of that program on educational outcomes. And the outcome variables we focused on two. One was learning levels of boys and girls. Another one that I will not talk about today is enrollment. And the way we evaluated this was through a village level randomized controlled trial, by which I mean we had, start with a, a group of villages, and to half of them we assigned them to Get Educate Girls program, where they recruited and trained community volunteers and deployed them. And then the other half of the villages, they looked the same as the villages where EG worked, but they looked the same before the program began, but they did not get this program. They only got us coming and measuring the learning levels. And so, did the program work? So this is, trying to show that impact slides showed, graphs I showed you earlier in the form of this graph. And so, we were able to assess that yes, that, answer the policy decision question of does the program work or not. So the dark blue bars here, if you can see my cursor, these are the learning levels for boys and girls in villages that got the program, and this pale blue bar are the learning levels for boys and girls in villages that didn't get the program. And you can see that these bars are significantly different. The learning levels are quite different, especially for math and English, less so for Hindi. What these bars are, my colleague Aya will explain when she's talking through our example in the Philippines. And so, yes, we were able to determine that the program, yes, it did improve learning gains. The more interesting part of this evaluation was that Educate Girls was able to use the program to improve the evaluation to improve their program. So, as I told you earlier, they had committed to improve learning levels by a certain amount over a 3-year period. And so that's on this graph. This year 3 target, was about this 5,592. That learning levels, that doesn't mean much. Just assume that they had agreed to achieve that much improvement in the learning levels over 3 years. And we did this evaluations, we did the survey every year, so at end of year 1, year 2, year 3. And so this is baseline before the program begins. And because these villages look the same before the program begins, the gap between them is 0, which it should be. So that means that the randomization has happened well. And then over time, the program works, so there is a improvement in learning levels between children who live in villages that EG works in, and children who live in villages where EG doesn't work. But the trajectory is, very low, so it's not going to, at the end of the third year, hit the target. And so EG was working, but not working well enough for them to be able to earn this payout. And at the end of the second year, they were able to then, for the third year, use this intervention and figure out why they were not, this evaluation, and figure out why they were not achieving their impact. And so they were able to make program changes. So they were able to identify that, one of the reasons was the supplementary training wasn't working well. They weren't being able to find uh, all the out of school girls to, give them that supplementary training. And so they were able to make program changes such that they not only achieved the target, but they actually smashed the target. They really exceeded the target. And that helped them get that sort of payout. They were able to, use this evaluation to improve their program in such a way that they were able to meet the predetermined targets. And then they were able to use this evidence to scale up, to get funding from other sort of foundations to implement this program in several other Indian states. Yeah. So that was one of the motivating examples for how we have used impact evaluation to help our partners take better decisions. Some of the common myths around impact evaluations are that they are too expensive, and to that, we have found that the scale, the duration, and the methodology, whether you use randomization or some other method, those can be tailored to fit within the available budget. uh, they often tend to take too long. However, when we have done these impact evaluations, we've been able to pull off things much faster. So within a 3 to 4 month period. And the reason is a lot of impact evaluations, when they're done by by academics, they tend to focus on sort of deeper outcomes that take longer to change, and that's why you need the evaluation to be in place for longer. But many of the practical decisions that policymakers have to take, those outcomes change faster, but there's also a way of identifying intermediate outcomes that can change uh, you know faster than the final outcomes. um, Another challenge is that sometimes governments can't randomize the intervention. They can't sort of give it to some but not to others. And so in that case, as I said, there are other sort of tools available to do a rigorous impact evaluation that's not a randomized controlled trial. um, then there is this slightly more nuanced and complex point about I'm just going to check the chat. Okay, so we're getting some questions. Okay, great. So we'll answer this. Perfect. So, there's this question of whether RCTs are ethical or not. And so, uh, many people argue that RCTs may not be ethical because governments cannot deny a program to a certain group of citizens. Now, uh, and that's because in a randomized control trial, you are sort of giving the program to the one group, but the control or the comparison group doesn't get the program. And so that's unethical and unfair. There's a few ways of thinking about that. One is, of course, that in some cases, especially more with NGOs than with governments, but also with governments, often you don't have enough funds available to serve every citizen. So there are sort of mechanisms to sort of give it to some but not to others. Some of these mechanisms are first come first serve type mechanisms, and in that case, something more randomization is you know uh, probably a fairer way of giving that allocation. The second is, we work with governments, and so we understand that often there is resistance to saying, oh, we can't not give this program to everybody. And in those cases, what we often recommend is to randomize the implementation or randomize the rollout, to give it to some first, and then sort of compare that first group with those who have not got the program, and then if it's working, then extend that to the others. Also allows you to refine the program before it goes to everybody. um, and finally, there's this point about the fact that it cannot be ethical to scale the program, to implement it at scale, to offer it to people without actually knowing that it's working, for two main reasons. One is, of course, that some of the impacts could be negative, and it's good to sort of measure that before we give it to everybody, and we don't know this before we start the program. The second is that there is a cost of funds, right? That you are, if you didn't spend this money on schools, you could spend it on health. If you didn't spend it on teacher training, you could spend it on buying infrastructure for schools. So there is a better way of spending that money that you couldn't realize once you do this evaluation. However, there are many other ethical issues involved, so we will not go into as much detail as this topic deserves in the course of this presentation. But we can discuss that more in the Q&A session if there are further questions. And finally, there's this point about impact evaluations being helpful only as academic exercises, as I've shown you in the Educate Girls example, and as Aya will show you in the other two motivating examples. It is possible to make them more decision focused, make them focused on helping you take a better, precise, specific, practical decision in your day-to-day policy making work, and they can provide sort of actionable evidence, and they can actually act upon. Uh, and and they can be implemented at various points of the program cycle. It doesn't have to be at the end. It doesn't have to be when the program is ready and has been refined over many years. We have worked with partners where we've implemented sort of impact evaluations at sort of much earlier stages of the program, where just to help think through which type of message should the government send, or how should it send by SMS or WhatsApp. Like those sort of minor nuts and bolts of the program can also be evaluated through these types of evaluations. I'll now hand over to Aya to take us forward.
I think before you do that, Karan, there's a question for you in the chat box.
Yes.
Is there any rule of thumb in determining ideal numbers of samples in impact evaluation?
Yeah. So is it okay, Linda, if we take all questions at the end? Because I think Aya will touch upon some of this particular issue in her slides.
Yeah, that's also fine.
Yeah. Thank you so much.
Great. Thank you so much, Karan and Linda. Great. So just picking up on a few things that Karan had outlined about impact evaluations, I wanted to talk through a few of the risks and mitigation. And I think this first point here actually speaks to the question that we had. I won't get to answer the question specifically, but we can discuss that later. One risk about impact evaluations is that the difference in groups that we see might be due to chance. When I say groups, I mean the treatment versus control. So in the example that Karan gave, maybe the difference in test scores that we saw between the treatment group and the control group might actually just be due to chance, or the reverse, like we might not see any difference, but it was also because of chance. And so it's really important to ensure a large enough sample size to measure the effects with more certainty. I'll share an example later showing a little bit more about what we mean by certainty and how a sample size can strengthen the evaluation by providing more certainty. The second risk is that there's a possibility of seeing null results, meaning we don't see any impact of the program, but it might actually be due to poor implementation and not necessarily that the intervention itself does not work. So, for example, in the example that Karen mentioned, maybe when we deployed the volunteers, they didn't quite know what to do, so they weren't very effective. So it wasn't so much about that deploying volunteers to encourage enrollment and learning is ineffective, but that the implementation suffered from several gaps that then made the project ineffective. So a few ways to mitigate that. First is to evaluate projects that are mature enough and are implemented consistently across project sites. It doesn't mean that necessarily that the projects have to be operating already for some years. It doesn't have to be that mature, but we would just like to avoid evaluating projects that are still but the elements are still changing a lot, because that could influence and affect the quality of the impact evaluation. But also a way to do that is to do a process evaluation. So process evaluation is an evaluation to see whether a program is being implemented as planned. It doesn't measure outcomes the way that an impact evaluation does, but helps understand whether implementation is going well or not. So potentially you can do a process evaluation prior to doing an impact evaluation to ensure that the operations are going well. Or you can do that alongside an impact evaluation. So again, I'll give an example of one where we did a process evaluation with an impact evaluation because it was a pilot. The third is that the magnitude of impact may be measured incorrectly. I'll go through this a bit quickly, but some key points here to mitigate this is to minimize the chance that the program spills over to participants in the comparison group. So, for example, if maybe the neighboring village hears about the initiative and does it as well, we want to avoid neighboring village that is part of the comparison group. If they do that, that would affect the magnitude of impact, so we want to avoid that. Another way to mitigate this risk is to track all study participants and account for those also whom you cannot track. So naturally, there are participants who will leave the program. So this is what we call attrition. So we want to avoid that and also track the ones that do leave the program. The third is to ensure that there are no other programs that may be implemented in some but not all sites that then would influence the results of the impact evaluation. So for example, in Karen's example, if in the comparison villages, suddenly there's a scholarship program that is being offered. And so that could dramatically change the results of the impact evaluation because our assumption that the treatment group and control group are exactly the same, except for this intervention that we're testing, that doesn't hold true anymore.
Aya, could I interrupt you for just a minute? Could we try it without your earphones? And I'm just.
Oh, you don't hear me very clearly.
I think it might be better without them. There's a lot of sort of.
Is this any better?
That's much better.
Okay, great. I will just use this end. Okay. Thank you for that, Linda. I hope the rest is clear enough, but hopefully this is going to be better. Okay, the last point on risks is that the results might be inaccurate due to poor data quality. And for that, there's a lot of measures to strengthen data quality. And we're not going to get to go through all of them, but I'll give one example of when data quality was very important in an impact evaluation. So I'll go and discuss this second case study that Karan mentioned. It's about hand washing in schools in the Philippines, and the policy decision that we wanted to inform was whether to scale up the program or not. So the challenge here that the team was trying to address was that hand washing rates at schools were very low, and that posed health risks to kids. So the spread of disease would be limited if hand washing rates were better. And this was even pre-COVID. So the solution was to implement a behavior-based intervention meant to improve hand washing rates of pupils. So this project was with UNICEF and the Department of Education in the Philippines. And we did an evaluation over 3 phases. So I'll give an overview of all 3 phases, and then I'll walk through each one of them. So in the first phase, we evaluated this project, which was called High Five, which again was a behavioral-based intervention. The intervention included things like doing games that taught about hand washing. There was a mural in the schools. Teachers would teach songs to students and would use storybooks about hand washing to students. We did school level clustered randomized control trial to measure the impact of the program. And along with it, we did a process evaluation. So it's important, as I mentioned, to do a process evaluation in this one because it was a pilot. It hasn't been implemented before. They wanted to test it out. So it was important to understand whether implementation was also going well or not. Kind of spoiler alert was that it turned out to not be effective. And we found implementation gaps. And so the decision was to strengthen implementation, try it again with much stronger implementation. So that was the phase 2 of the evaluation. The implementation was improved. And in this one, you'll note that we did a pre-post event study. So ideally, we would have done an RCT as well, but to Karen's point earlier about RCT not being the only way to measure, we did a pre-post event study, which just means we measured what happened before the program and happened after the program. It was not operationally feasible for us to do an RCT for several reasons. 2 that I'll share is that the first one was that the control schools in the first phase were promised that they would be implemented the program after this first phase. So the program had to be implemented in all of those schools. And the sample size would have been too small to try to randomize within the remaining schools. And so we decided to do a pre-post event study. We did not take that decision lightly. There were several conditions that allowed us to do so with high enough confidence. So while it wouldn't be an approach that we would recommend, so I hope you don't come away with this saying that like, oh, ID Insights had a pre-post is totally fine. But in certain cases, under certain conditions and assumptions, it might be possible. And in this case, it was. So we did a process evaluation as well. Again, spoiler alert was that it still didn't work. And so the decision here was that, okay, like we really can't scale this because it's not effective. What do we do now? And the decision was to redesign the intervention completely. Let's try something entirely new to come up with a solution that might actually work. And so the third phase was to develop these new behavioral nudges and do an impact evaluation in a new area and a process evaluation with that. So I'll share the results. So on the phase 1 of the impact evaluation, what we were measuring was the hand washing rates. So to the point that Karen was making about long-term outcomes versus shorter-term outcomes, in this case, we decided that just measuring like actual hand washing was going to be sufficient. Even if the ultimate goal was to decrease disease transmission, that would be too long for the decision whether to scale up the program or not. And so an intermediate outcome like people hand washing was sufficient for that purpose. And so what we found was that for pupils in schools that were given the treatment or given the program, their hand washing rate was 5.5%, the darker blue bar. And then in the control group, it was 2.2%. So coming back to this point about the bars here and certainty. So what the bar here means is that the true estimate might not exactly be 5.5%, which is the bar here. It could be somewhere within this range, and then the control group as well. So if we want to be more certain, meaning we want these bars to be narrower, that would entail us having a larger sample size. And if we're comfortable with like less certainty, we can have smaller sample sizes, but the trade-off there is that these bars would be much wider. So as you can maybe tell with what we have here is that the difference between the treatment and the control group was barely statistically significant, but kind of more importantly also, it fell far below this minimum desired result. So even prior to doing the evaluation, we sat down with UNICEF and discussed what would it take for you to feel that it would be worthwhile to roll this program out into all public schools in the Philippines. And the decision was that if we are able to hit hand washing rates to be 15% and ideally 20 to 30%, that would be good enough to scale. And so what we found was that even if the intervention did improve a little bit, it was still far below the minimum desired results, and so it wasn't good enough to be scaled. So what did the process evaluation results say? So it actually revealed that there were implementation gaps. So some examples were teachers lacked training to deliver the tools, planning was inconsistent, the monitoring tools were not used. And so the decision was that, okay, let's try to improve implementation. So maybe it wasn't working because there were these implementation gaps. It wasn't so much that the actual interventions were ineffective, but maybe they just weren't doing it well enough. So UNICEF and DepEd's decision was to revise the program. We recommended certain changes to how it was being implemented to make sure that the program was being delivered well. So then after doing these revisions, we did the phase 2 of the evaluation and found that it was better. So this is the darkest blue bar at the right side. Now at about 7.5% of hand washing rates, better than what it was in phase 1, and more visibly, like significantly better than the control group. So statistically significantly better, but in terms of like the practical side of it, 7.5% was still very low. It still didn't reach the 15% threshold that UNICEF set. So then the question was, okay, like, are we still seeing implementation problems? Is that still the driver of these disappointing results? What we saw was that it was not. The process evaluation revealed that the implementation was actually going well. The teachers understood how they were going to implement it. They implemented it well. Schools planned for it well. They were well prepared, and the program was monitored well. And so the result, the conclusion was that it's not because of poor implementation. It really is because the intervention just doesn't work. So that provided enough information for the implementers, both the Department of Education and UNICEF, to make a decision to not scale the program. So they really wanted to scale this program. They wanted to promote it, but it was not effective, so it wasn't worthwhile to scale. One side note that I wanted to make was about data quality. So as I mentioned, data quality is really important. And in this case, when one of the ways that data quality came up was about how we would measure the outcome. So how should we measure hand washing rates of pupils? So there are many ways that we could measure it. In this study, we did it with 2 ways. One was self-reported, so just asking teachers and students, Did you wash your hands after during critical times, which is after going to the bathroom and before meals, and just asking them. The second way is through direct observation, meaning there's a surveyor sitting in on classes observing whether kids are actually washing their hands at critical times. And as you might expect, self-reported measures inflate the true rates because of social desirability bias. So that just means that if you ask somebody whether they wash their hands or not, they will give you a response that they think you will want to hear, which is, yes, I wash my hands, even if in reality, they don't always wash their hands. And I wanted to share how dramatic the difference was. So if we had relied on these self-reported figures over on the left side, we were seeing hand washing rates being 80 plus to 90%. A very, very big difference with the rates of hand washing that we saw with direct observation, which, as I mentioned earlier, were more in the 5 to 7%. And so this is really critical for impact evaluations or just data in general about making sure that the quality of data is good, because as you can tell, like if we had relied on self-reported data and we were seeing numbers at 80, 90%, then the conclusion would have been, yes, let's implement this program. It's effective. It is above the threshold. But the reality is that it is actually much lower. So as I mentioned, this information informed national policy so that instead of scaling up the program across all schools in the country, the UNICEF and DepEd opted to test alternative behavior-based hygiene interventions. I won't go through the redesign as much, but this was actually what the redesign looked like. So ID Insight helped redesign the behavior-based interventions. And what we did was have installed behavioral nudges. So if you see the footprints on the floor, we installed those to encourage people to go to the sink, install these posters. There are these like eyes and arrow pointing to the soap to have more physical reminders of hand washing. And we did this from late 2019 to early 2020, just before COVID, showing that these behavioral nudges actually increased hand washing rates by 148%, even 4 months after implementation, which was when we measured the hand washing rates. So hopefully this will be scaled. There were plans to scale this already, except that schools are not in session in the Philippines currently because of COVID. But these impact evaluations really help UNICEF and DepEd select the right solution. So understanding what solution was not effective and what could actually be more effective. And then the third case study that I wanted to share was on these distributing insecticide-treated nets in Zambia. And as Karan mentioned, the decision here that we wanted to inform was which version of the program to scale. So in this case study, the challenge, the developmental challenge was that malaria is a leading cause of infant and maternal mortality and morbidity. And insecticide-treated nets are known, in the literature, it's well studied already, that they're known to decrease malaria incidence. But the correct method of how they were distributing these bed nets were resource intensive, and these were door-to-door. So the solution was to evaluate more cost-effective alternative modes of delivery to see if there is a different way of distributing these bed nets. The government needed to distribute 6 to 7 million bed nets, so it was important to find a cost-effective way of doing that. So again, the question here was not whether to give bed nets or not. We knew that it was important that this is going to be done, but the question was more about how do we do that and how do we do that cost effectively. So we built on measures of effectiveness from an impact evaluation and added onto it, combining that with data on cost to make a decision on what version of the program to scale. So the Ministry of Health in Zambia and the National Malaria Control Center commissioned ID Insight to evaluate if, as an alternative to door-to-door distributions, we could do community point distributions instead. So the current method, as I mentioned, was door-to-door. So what happens there is that community health workers visit every single household to distribute the bed nets and then help them hang them up at home. So this was the standard method. It was very expensive. The alternative that was being explored was this idea of community point distribution, where households instead come to a central location in the community to collect their bed nets. As you might expect, the concern here would be that first, the community point distribution would be cheaper, but we're not sure whether it would be as effective. So there's a concern that maybe households wouldn't come to get their bed nets, maybe they wouldn't hang them up, maybe they wouldn't use it if the community health worker doesn't distribute it and give it to them individually. So then we conducted an RCT that considered these distribution methods, the door-to-door visits, which were the status quo, which again was the most costly approach, the community point distribution without any hang-up visits, which was least costly, and somewhere in the middle where the community point distribution was done, but community health workers would still visit, but sometime later. This was, in terms of cost, kind of in the middle, because what happens is that community health workers, when they visit after a few weeks, they don't necessarily always have to hang them up. So some households would hang up the bed nets independently, and so when the community health worker visits, they can just inspect and not necessarily spend time hanging them up. So the outcomes of interest were a few. As I mentioned, we want to make sure that we're reaching the households that we want to reach. So what we found was that community point distribution was just as effective as door-to-door, and it was less costly. So on this first point about effectiveness being the same, so we found that usage of the bed nets was similar between distribution methods. So community point distribution reached 96% of the households, so almost all of them. Households who went to community point distributions had an average of 75 to 80% of their sleeping spaces covered, which was comparable to the door-to-door visits, which found a coverage at about like 79% after 8 weeks. Between the two methods of community point distribution, we also found that there was no real difference with the hang-up visit after 5 to 6 weeks of distribution, meaning for those who received a hang-up visit and for those who didn't receive a hang-up visit, the usage was pretty much the same. So then it was pretty clear that if they were just as effective, then we can go with the least costly option, because we're not compromising effectiveness with a lighter touch model. And so in terms of the cost side, what we measured was the time savings of these community health workers. And we found that if we do community point distribution with hang-up visits, that reduces the time that it takes community health workers by 25% compared to door-to-door distribution. And without hang-up visits, it's a 59% reduction. So as a result of these findings, the Zambian Ministry of Health changed the national guidelines to allow districts to choose community point distribution instead of door-to-door to distribute ITNs. And in terms of cost savings, that resulted in almost $2 million in cost savings because of the saved time from community health workers. So just to highlight a few takeaways before we get to the questions, I'm seeing several in the comments already. So first is that I hope um, you got to see how impact evaluation can and should be used for decision making to improve the social impact of programs. Especially having, and I think it's critical here to already have the decision from the very beginning to know what we are trying to inform, so that the impact evaluation can be designed to help inform that decision. And again, we saw a variety of types of decisions that could be made, whether to scale up a program or not, whether to what version of a program to implement, and to and whether we can course correct. So second is that impact evaluations don't necessarily have to be these large, complex, multi-year initiatives to be rigorous and useful. There are ways to make these impact evaluations rigorous and useful, even for potentially a shorter period of time, a more limited scale, and so forth. But at the same time, impact evaluations do have to be designed and executed well. Even if they're not these multi-year initiatives, they have to be done rigorously and be done well to avoid misleading or incorrect results. So we do not want to be in a situation where the results say that it's effective and it's actually not, or the reverse, that an effective solution might not be visible because the evaluation wasn't designed well. So it's very important that these are designed and executed well to have the correct results to inform decisions. So we can move to questions, and I'll pass it back to Linda.
Thank you very much, both of you, Karen and Aya. I think that the way you presented about impact evaluation is not an easy topic to grasp, actually. And I think that your presentations, Karen going first on the sort of method and then the case studies is really effective. I noticed that the questions, the issue is that the topics you chose for the case studies are so interesting, the hygiene issue and then the nets, that there's a lot of interest in the actual issue itself rather than the impact evaluation. So when you look at those questions, please do try to answer both in terms of impact evaluation and also the actual issue in question. But thanks to both of you. And I'll just let you, the two of you, go through the questions yourselves and maybe just repeat the question so everyone can hear it and go ahead and answer them. Thank you.
Great. Thank you very much, Linda. I can start with the first question from Dharendra, and then I'll pass it on to Aya. So, Dharendra's a very good question on, is there any rules of thumb in determining ideal numbers of samples or sample size in an impact evaluation? And he said this particularly, he said, because he said, I mentioned that impact evaluations are not necessarily expensive, and what he was talking about was that sample size is a big contributor to the cost of the impact evaluation. So can we reduce the sample size to become more cost effective? This is a great point, and thanks a lot, Dharendra, for raising this. I'll answer it in two parts. One part is to say that a priori right now, it's very hard to say what the rules of thumb of an impact evaluation should be. Right, as some of you may know, it depends on a large number of factors. In particular, it depends on what is our expectation about how large or small this effect is going to be. If it's something that's going to, the smaller the effect, the larger the sample size you need. So it's a bit like saying something about if it is really a very, very small effect, if it's really small change, and you need like lots of pixels on the screen to be able to pick that difference up in the bars. So you need a huge sample size if it's a very small effect. But if it's a very large effect, then you can pick it up with a smaller sample size. So one is that effect size matters. Another is whether you're doing this at the individual level where you're giving it to some program participants, not to others, or whether you're giving it at the sort of at a larger level of aggregation, say schools or villages or clinics, as some of our examples here were. And so, some of those issues make it hard to sort of say what the rules of thumb on numbers should be. But it is right, Dhirendra, your broad point that impact evaluations often can have a smaller size than academics, or then uh, let me phrase it this way. Impact evaluations that are geared towards helping policymakers answer questions for their practical decision making can have a smaller size than those that academics need or do for their sort of academic studies. And I think the difference is, something that is driven by the certainty of the result, right? So I was talking about those uncertainty bars. And so, the thing is, when we are in the policy making world, we have, a pretty good idea of, what's going to work and what's not going to work. And so the bar of conviction is kind of lower, right? Like I need slightly lower sort of confidence to know that, look, yes, of course it's going to work, and yeah, it's working, because academics tend to be very skeptical individuals, and because they're skeptical individuals and because their editors of journals are very skeptical individuals, they need a lot of the bar of proof is much higher than that you need for decision making. And so we've definitely gone in many of our work with sort of lower sort of lower bar for what we need to be convinced that this is going to work, and have been able to lower sample sizes and have been able to lower sample size in that way. And so that's a good point that impact evaluations don't need huge sample sizes. If you do want to give me if you want me to give you sort of numbers, what I can say, it's rarely going to be the case that 10 or 20 villages are going to be enough for an impact evaluation. You often need more than that. But yes, you're right to say that you don't need 1,000 or villages in your study to be able to do a rigorous impact evaluation. Aya, I can pass you on to the for the other questions.
Great. Thank you, Karan. I can answer the questions on hand washing. So the hand washing research was done prior to the pandemic. So the first phase in 2017, the next in 2018, the behavioral nudges one, where we had the footprint, the arrows, and such. Those were done. Those were installed in about October 2019, and then we collected our endline data around January 2020. So actually, right before the pandemic. And then the question on whether the behavioral intervention was done with schools with adequate water supply and soap, and whether that was provided by the project or the schools. So I'll answer this in parts. The first is that we did have to screen the schools. So because the intervention was really just to improve the behavior, as a starting point, we needed schools that already had water. So it would be silly to try to do a behavior intervention if the schools didn't have water at all. So just to get a sense of like how that would look like, how that was like, was we screened. So this was done in Zamboanga del Norte. We screened about 600 schools with that as a criterion about like having adequate water supply and facilities for hand washing and a few other criteria. We narrowed it down to about 210 eligible schools, and then split that group up between treatment and control. And so the facilities and the soap were provided by the school themselves. We provided the footprint, the arrows, and so forth, but the actual facilities and the soap were provided by the school. Actually, as part of the evaluation, we also measured whether there were increases in the facilities themselves, if there were any improvements in the facilities themselves, because of the intervention. That maybe having the intervention itself would encourage teachers and principals to provide these facilities. And we saw a little bit of an increase, not very dramatic, but about 7 percentage points on facilities that they were better, that they improved in treatment schools. And it was statistically significant. And then the question on whether behavioral nudges is a common intervention in other wicked public policy problems. I will answer this more from my perspective. Happy to hear Karan's thoughts. So this is probably more personal, but um, I think behavioral interventions are very useful, but maybe not for wicked problems, like the way that wicked problems are defined, where they're very complex problems. Um, and I think that these behavior interventions can be useful in particular um, conditions where the barriers really are because of behavior and not structural. Not so. For example, for the case of hand washing, it was appropriate because we knew that knowledge wasn't a problem. That it wasn't because people were not washing hands, kids weren't washing their hands, not because they didn't know it was important, but it really was this gap between knowledge and behavior. And similarly, as a question, another question was raised about facilities. We were addressing these in schools that already had the facilities. So it definitely wouldn't have been a solution for installing facilities, for improving water supply, which would entail a very different set of interventions, but could be useful for particular scenarios where the problems are more behavioral. Yeah.
Just to let you know that we've got about 8 minutes left. And could I ask everyone to turn on their cameras because we'd like to take a screenshot at some point. So just go ahead and turn them on and please continue with your questions and answers.
Thanks, Linda. If I can just quickly add to Aya's point about behavioral work, I think we've definitely done interventions, behavioral interventions that didn't work for precisely this reason, right? One is this knowledge. And the other thing to add to that is the issue of wanting to actually undertake that behavior. So, nudges will be able to nudge you if you want to. Like children, they know that they should wash their hands and they, want to wash their hands. They just sort of don't do it because, they don't see the water immediately when they come out of the washroom, for example. In similar ways, we did an intervention in India around using toilets rather than defecating in the open. Again, that was not as successful because when people know that they are not supposed to open defecate, but they don't like toilets for the reasons. And so people are using their not using the toilets, they don't want to use the toilets. So no matter how much you nudge them, they're not going to want to be nudged. And so you need both the knowledge and the desire to do the action, and then nudges are more likely to work. Um, I can move on to the other question. I mean, in terms of I'll take Deepa's question first around in case the baseline is not available, how do you address the issue? Can we still undertake an impact evaluation? It's a great question, and I think the to not give too technical an answer, Deepa, perhaps you can, sort of, our email IDs are in the presentation, so you can contact us after this. The answer is yes, it's possible, but it's going to be challenging. And we have done evaluations where we didn't have baseline data, but were able to sort of find a comparison group, create a comparison group later on. But that's usually, it's not as rigorous as collecting baseline data or sort of randomizing before you implement the program. So sort of a related point on this, that you don't actually need baseline data. What you need, let's say we had the educate girls work. We have 200 villages, we assign them 100 of them to the program and 100 of them to not receiving the program. And then we actually don't need baseline data. We can just run the program for 2 years and evaluate at the end of 2 years, and that's going to be fine, because remember, we have randomized this. So basically these groups look as similar as possible before the program begins. So we don't need to actually know learning outcomes. And baseline data, of course, helps with many other things. It helps you reduce the uncertainty, and so be able to measure things more precisely. It reduces that uncertainty bars that I was telling us about. And it allows us to think about, okay, at baseline, who was doing most badly and who was doing really well, And so, how does the treatment affect them differently? Maybe this program is really good for people who were, doing very well at the beginning, and not so is not great for people who are not doing so well at the beginning. So those type of questions can be answered if you have baseline data, but strictly for the impact evaluation, you don't need baseline data. However, you need to have done that randomization before you begin the program, so that you are assured of the fact that the people who are not getting the program, they're looking just like the ones that get the program. That having been said, it's possible, you know, that given the program context, given how the intervention was delivered, given that maybe it's possible to construct a comparison group and to argue that that comparison group looked just like the people who got the program before the intervention began. It's possible, but we can talk more about the specifics offline. um, in terms of, is there a long-term option to solve the problem of malaria? That's, I think, a very hard question for both Aya and me to answer. You know, uh, and so uh, and so I'll sort of leave that aside for now. Aya, unless you want to tackle that.
Yeah, not much to add. Just to be very honest, I think, yeah, I'm not a health expert, so I wouldn't have a more nuanced answer to this. But I do think, just connecting to our earlier discussion, this problem of malaria is more of a wicked problem. And the solution that we were talking about was a bit more on the behavioral side. So it was tackling one part of the problem, as you said, like, yeah, probably just within, a certain margin of where we know that people actually want to do it, but there's some behavioral barriers, not meant to be a substitute for more long term, and yeah, like permanent solutions to malaria, which I wouldn't be very well positioned to speak about.
There is an important question there. In case baseline data is not available, how do you address the issue? Can we still undertake an impact evaluation?
Yes, I just answered that. That was the response to Deepa, which is to say that yes, you can, but it's going to be less rigorous, and it's going to depend on a number of things, like how the program was delivered and whether or not it's possible to, after the program, construct a comparison group. So
okay, Aya, one thing about the hand washing. You said that of course everyone understands the importance of hand washing. I am not sure about that, because I don't know if everyone understands the connection between transfer of E. coli and then the resultant health impacts. So that's one thing. Not sure if you can make that assumption. The other thing about the case in the Philippines is very fascinating, that Filipinos are perhaps the best at brushing their teeth I've ever encountered. However, that has not transferred over into hand washing. And it may be interesting. I wonder if anyone looked at the campaigns around brushing, teeth brushing, and sort of tried to move those over and use those for the hand washing. So different intervention, but maybe could have had an outcome, a better outcome.
Yeah, that's a good point. On the knowledge issue, I didn't mean to like generalize to everyone. In the case of the study, we did ask knowledge questions, and at least for the kids in the study, it was pretty clear that they knew that it was important to wash their hands, when they should be doing it. Although, like, there was a slight improvement in knowledge, but just the disparity between the knowledge levels and the behavioral, the actual behavior, really signaled to us that it is more of a behavioral problem. It's a very interesting point you raised about like brushing teeth, and how the behavior there is somehow just great, and how that might translate. We didn't like really look into that specifically, but I think good for researchers in the behavioral nudges space to understand these these like barriers in behavior, these potential gaps to address with these interventions.
I think we're coming to the end of our time and we may be cut off very, very quickly. So before that happens, I want to thank you both again very much. And I think it was a very worthwhile session. If you can turn your videos on and give appreciation for our presenters, that would be great. But also to the government officials who registered for this. Really encouraging to see your interest, and hope to be able to do more of this in the future if it helps you, and would very much appreciate your feedback on how it can contribute to your efforts in government, particularly around policy making. So thank you again, everyone. I really enjoyed this session, and I hope all of you did as well.
Thank you very much, Linda, for facilitating this. Just I wanted to say that, if you want to have any more questions, please do contact Aya and me. We are very happy to answer them later.
Thank you, Karen.
Yeah, thank you so much, Linda. Thank you for all of our participants. Yeah, this was a great, a very engaged session, and very grateful for your participation.
Great. Okay, and I think we will all leave breakout rooms, and then we will return to the main session. Thanks again. Bye, everyone.